I will discuss today the top 5 reasons of kidney failure. I am Dr. Ebadur Rahman from Evercare Hospital, working as Senior Consultant Nephrologist. I will discuss today the top 5 reasons of kidney failure. Before that, we will go through what kidneys do to our body. Let's go through what the kidneys do for us. They remove waste products and also they remove the extra water. They help make red cells. They help control our blood pressure and they help make vitamin D. What is kidney failure? Kidney failure means when the kidney functions are lost by 90%, then we call it kidney failure. And this is not enough to keep us alive. There is no cure for kidney failure, especially for chronic renal failure. But having kidney failure is not a death sentence. The life goes on and we have multiple options to deal with it. Now let's look at the causes of kidney failure. The most important cause of kidney failure is high blood pressure, followed by diabetes worldwide. Then we have the glomerulonephritis, congenital kidney disease, obstruction and upper urinary tract infection. Let's see what happens when kidney fails. We get trouble sleeping, there is poor appetite, feeling of weakness, tiredness, excessive itching, weight loss, muscle cramps, especially in the legs. We also develop swelling in the feet and ankles, and in children, swelling in the face, and we also develop anemia or low blood count. Now let's look at the options of treatment of kidney failure. We have two options. One is to replace the kidney, what we call renal transplant, or to give dialysis. We have two modalities of dialysis. These are peritoneal dialysis and hemodialysis. Now let's see what treatments are available for kidney failure. We have options to change the kidney, what we call renal transplant, or to replace the functions by dialysis. We have two modalities of dialysis. These are peritoneal dialysis and hemodialysis. Let's look at the best modalities of treatment. The best modality of treatment will be discussed in next episode. Modalities of treatment and what option I should be choosing for my patient. We will be discussing these in detail in our next video episode. You can always consult me through our webpage www.drevadurrahman.com or consult us in following telephone numbers.